Hey everyone, welcome back to the Mass Retirees Weekly Update. Today's Friday, January 20th. I'm Sean Duhamel. Thank you so much for joining with us and tuning in again this week. Now, we've had a lot going on and what has been a short week here on Beacon Hill. Monday, of course, was the Martin Luther King Day holiday. We have been busy ever since. This was the bill, or is the bill filing deadline today at 5 p.m. I'm happy to report all of the mass retirees' legislative proposals were filed earlier this week. We will be publishing the docket numbers along with the key sponsors and a little bit of a summary in our March newsletter. Take a look at what we have filed. If there is something that is of specific interest to you, we urge you to join with us in advocating by contacting your local legislator or legislators in support of that legislation, and then we will be reporting on the progress of those bills as the session moves forward. But we are very early in the session. There really has been no conversations around any of these proposals as of yet. The legislature has not assigned committee assignments for the coming session or this session. We anticipate that happening sometime in early February. Legislative hearings will most likely begin in late February or early March. So really look to the May newsletter for some updated information in terms of what's happening specific to those proposals. But this week was really the launching point for all of those activities. In addition, we also participated in and attended the inaugurations of our good friend, State Treasurer Deb Goldberg, as well as our friend, State Auditor Diana DeZoglio earlier this week. And of course, our friend Andrea Campbell was also inaugurated on Wednesday. So there was a lot going on. There's a lot of excitement here in Boston on Beacon Hill in terms of all of these new leaders taking office. And this is really the first time in more than a generation where we have had so much change taking place all at once amongst these key offices and office holders. So we are really excited for things to finally gel together and that we can get moving on your behalf of trying to advance some of these proposals. And I touched on those key points in last week's message. But the key focus this week is really on your health insurance. As we have been reporting for quite some time, the States Group Insurance Commission, for the better part of a year or more, have been engaged in the procurement process for all of the health insurance plans offered by the GIC, as well as the pharmaceutical benefits offered by the GIC. And those plans had begun to come together last October when the Commission announced the selection of the health insurance providers that they will be offering for FY24 and beyond. There will be 7 non-Medicare plans offered by the GIC and 4 Medicare plans offered by the GIC, and then 1 national health insurance provider for those retirees living outside of New England. So those were the changes that were announced back in October. We are very satisfied with the choices that are being offered and the high quality plans that were selected by the GIC. In December, the announcement came in regard to pharmacy benefits managers, the so-called PBM. And CVS Health, or CVS Caremark as they're known, were selected for both the Medicare, providing CVS Caremark Silver Scripts is the name of the Medicare pharmacy benefits, and CVS has also been chosen to replace Express Scripts on the non-Medicare side. And I want to be very clear, pharmacy benefits management in the PBM is very different and operates very differently than the retail pharmacy locations that you might shop at in your local neighborhood. Now, just because CVS is the pharmacy benefits manager, that does not mean that retirees or active employees or anyone has to shop at the CVS retail locations. They're two separate things. So if you shop at Target or Walmart or Walgreens or some local mom and pop pharmacy, you can continue to do so. But if you are receiving your prescription drugs via mail order, that's where CVS comes in. They're the mail order provider. They also manage the overall benefits and monitor drug interactions and those sorts of things. Now, we had also been reporting and very much anticipating the GIC meeting that took place just yesterday. And at yesterday's meeting is really where the rubber met the road in terms of the plan design and the co-payments and the deductible changes that we weren't sure of what was going to come down the road. Now, I am very happy to report that by and large, we will see very few changes to the GIC's plan design for the coming fiscal year. To start with, there will be no changes in out-of-pocket costs, so in other words, co-payments when it comes to your prescription drug benefits, other than changing the PBM for the non-Medicare retirees over to CVS. There will be no changes in the co-payments paid for your prescription drug benefits under the GIC. There will also be no other plan design changes relative to your prescription drug benefits. Now, that does not mean that the prices of individual drugs can't fluctuate or the formulary that the PBM goes by may or may not change. Those changes take place constantly from day to day. Drugs move on and off of formularies and they go to different tiers. Those changes are relatively routine. But when it comes to the copayment that you're required to pay, there will be no change. And this, in fact, will mark the 6th consecutive fiscal year where we have had the same prescription drug copayments. At a time when virtually every other product is becoming more and more expensive and in some cases skyrocketing in terms of costs, it is very encouraging to see the GIC holding the line in terms of the cost of your prescription drug benefits. Now, one of the points that Matt Vino, the executive director of the GIC, and his staff have continued to make over and over again is that throughout this procurement process, that one of their goals was to cause the least amount of disruption to enrollees as possible. They also wanted to make sure that they were not making anything more complicated or confusing and trying to take steps to correct some of the plan design and the verbiage and titles being used and all the gobbledygook that we see when it comes to healthcare, to try to make all of that a little less complicated while they're at it. And from what we have seen so far, they're largely succeeding with both of those goals, and I can't be more thankful. Now, that does not mean that there will not be individual changes that are made that may or may not have a negative impact on certain enrollees or certain retirees. Anytime you're making changes to something as important as health insurance and health care, there are going to be disruptions. There are going to be people who have some type of a negative impact. It's really unavoidable, despite the best efforts that everybody makes. But what I can pledge to you is something that Mass Retirees has lived by since our founding back in 1968, and that is that we're here for you. If you have a question about something, if you have a problem when it comes to your health insurance, we're just a phone call away. You can call Cheryl Stillman, our insurance coordinator. You can call Nancy McGovern, our legislative liaison, Bill Reary, our general counsel, Frank Valeri, our president, or myself as your CEO. We're here for you to try to help you walk through whatever these challenges may be, try to resolve any insurance problems you might have. And that's also a pledge that Matt and his staff have made to us again. And when I spoke with Matt yesterday afternoon, following their meeting, it was one of the first things he said is that they want to make sure that they're here for us. They want to make sure that they're here for our members, and they are going to go out of their way to work with you to help through any transitions that are taking place, whether it is due to some of the plans that are currently being offered, like the Tufts Navigator, for instance, that will be discontinued at the end of this year. And by the way, that's not a choice of the GIC. As you may know, Tufts and Harvard Pilgrim have merged into one company called Point 32, and it is the decision of the now combined company that they're going to discontinue the Tufts Navigator as an insurance product that they're offering. But we know that we have 30-some-odd thousand retirees and active public employees who are currently participating in the Tufts Navigator, and that they're going to either shift or migrate to a different insurance plan during open enrollment this spring, or if you choose to do nothing, you'll be automatically enrolled in the new Harvard Pilgrim plan that's replacing the Tufts Navigator. It's called the Harvard Pilgrim Explorer, from what I understand, and that is virtually the same type of coverage that the Navigator plan has made or has provided all of these years. But there are going to be a variety of these small tweaks and changes and different plan names. And if you have questions about any of those types of things, please do not hesitate to reach out to one of us. We're here to try to help you work through that and resolve those problems. Now, when it comes to the annual deductible, again, good news here. As you might know, the annual deductible only applies to the non-Medicare plans. And right now, for the past 5 years, that annual deductible has been $500 per person or $1,000 for a family. That is remaining the same. There is no changes being proposed to either increase or alter the annual deductible for the non-Medicare plans. So we are very grateful for that. The one area where we may see some changes is when it comes to the non-Medicare doctor's visit copay or office visit copays that some plans are charging. There are going to be some streamlining and standardization of these various tiering and copayment levels across all of the plans the GIC is offering. Part of this is being done to try to streamline things a little bit more and avoid some of the confusion that currently exists from comparing one plan to the other. But because of that, it is going to result in some relatively minor, although cost increases for some retirees. And again, overall, we think this is very good news. But for those of you who might experience a minor increase in your out-of-pocket costs, it is a big deal. We understand that. We're not thrilled about it. I know the GIC is not thrilled about it, but as I said earlier, some of these changes can't be avoided. We're just very grateful that they are occurring on a much smaller scale, and we're not seeing any cost shifting going on or wild jumps in prices. Now, let me close with some very good news. The GIC has chosen, in conjunction with, in collaboration with Unicare, and this is a move that Mass Retirees completely supports and we're very happy about, but the GIC going forward will standardize the so-called CIC coverage, the optional CIC coverage that has been available for decades when it comes to the Unicare Basic Plan as well as the Unicare Optional Medicare Extension Plan, the OME plan. Retirees have had the choice to add what's known as CIC, or catastrophic illness coverage, I believe is what it stands for, to be an additional coverage along with your basic insurance. Now, up until now, the cost of CIC has been entirely borne by you, the retiree. That is about to change. The GIC is mandating that CIC coverage become an automatic part of both the Unicare Basic Plan as well as the Unicare Medicare Extension Plan. And retirees will no longer have the option of not having CIC coverage. And in addition, the state will be picking up its share of the cost of CIC. As I said a minute ago, up until now, retirees have been required to bear that entire cost of CIC. Now the state will be picking up either 80% or 85% or 90% of that premium, depending on which contribution split you happen to be at as a retiree. Now I realize local retirees who are insured by the GIC have a slightly different contribution split, but the state and the cities and towns will be picking up their share of this cost, which will save retirees in the coming fiscal year $18 million that you otherwise would have had to pay for. So that's great news for our members, and it's also going to ensure that retirees have the quality insurance coverage that you need, and that you're not taking any type of unknown or an undue risk when it comes to your benefits and suddenly discovering that you're not fully covered. This will ensure that all retirees have full insurance coverage, and we're very happy about this change. Now, the last thing I want to leave everybody with, which is, I should have led off with this. Today, on Friday, January 20th at 1:00 p.m. Eastern Time, we will be hosting a Mass Retirees members-only teletown hall event. This is a very special meeting because it will feature the Group Insurance Commission Its executive director, Matt Vino, will be with us for the full hour to an hour and a half, as long as we have members on the line. Matt's going to be with us. In addition to him providing an overview of some of the things I've been talking about, he's most looking forward to taking questions from our members and hearing directly from you, whether it be a question, a comment, a concern, a criticism, praise, whatever it is that you have on your mind when it comes to your GIC health insurance coverage. If you want to share that with Matt and his staff, who will also be on the line with him, today at 1 o'clock is your opportunity to do so. Over the past few years, Matt and the GIC have participated in at least 2 or 3 other teletown hall events. But today's event, because of the upcoming changes with the healthcare coverage and plan design taking place, today's meeting is particularly important. So the meeting kicks off at 1 o'clock. There are 2 ways you can participate. One is by receiving the automated phone call that will come from me at 1 o'clock. All you need to do is answer your phone, stay on the line, and you're going to be automatically connected to the meeting at no cost to you. The second way you can participate is by calling the toll-free number that's published in today's email blast. It's in the newsletter on page 3. It's also on the back of your Mass Retirees membership card. You have our hotline number, which is our weekly news hotline, and you have our teletown hall number. So those are the ways you can participate. We are hoping for a fantastic crowd today. This is a very unique opportunity for you to have to make sure that you have a voice in this process and that your voice is heard by the folks who are making these decisions that impact you and your health care and your family's health care for the next several years. So if you're available at 1 today, join with us. Thank you so much for tuning in. We will be back to you again next week with a fresh update, but in the meantime, be well. Thank you for your membership of Mass Retirees, and we'll talk to you again very soon.